Afternoon to you. The EFF again taking up a fight for a worthy cause. Tell us more about this. What are they hoping to achieve through this march?
Indeed, good afternoon, Natasha. As you've indicated, the EFF held their strategic meeting earlier this month, and after that meeting they announced that they had dedicated this year 2018 to public health care. And when they spoke earlier at the beginning of this march, they said to us that what they are looking for is to ensure that ordinary South Africans get affordable but quality or high quality public health care regardless of where they are. So they are starting here in Johannesburg, but also you can imagine that looking at the events of last year with Life Esidimeni, that's probably the reason why they're here. But also very symbolic is the hospital that they're coming to. It is the Chris Hani Baragwanath Hospital. This is a hospital that's named after a stalwart, a great liberation fighter here in South Africa. But also, Natasha, you can also know that when you talk about incidents that make headlines in terms of poor public health care in this country, a lot of the time you will hear Chris Hani Baragwanath Hospital. So later on we will talk to EFF Leader Julius Malema. He's here right behind me there. They have just walked from across Soweto and coming through here to the entrance of the Chris Hani Baragwanath Hospital. Julius Malema and the leadership of the EFF are here, and they will then tell us later on why it is that they decided to start this particular campaign here in Soweto. Natasha.
All right, and as you mentioned, the Life Esidimeni tragedy of last year, and especially the fact that we used to have world-class hospitals, especially in Gauteng. So if you look at the success of the land motion that was tabled last night in Parliament, how far they're wanting to take this demonstration, how far they're wanting to sort of make changes to public health care?
I think I'll have to refer to what Julius Malema said when he announced that they had decided to dedicate 2018 to the year of public health. He said that when you hear what people say about their experiences with public care in this country, you know, your skin crawls really, particularly when you talk about incidents that they have already heard of. As you indicated in your introduction, Natasha, doctors who are racist, who don't even want to touch patients, but will prescribe medication without even knowing what is wrong with the patient. The patient comes in and they just ask them what is wrong with you because they avoid touching such patients. But also when he outlined people who had talked about the experiences that they come across when they go to get, for instance, medication for HIV in the hospitals. He says that people go into a public area and a nurse will come out and say to them, those of you who are HIV positive, come to the left. And so that is unacceptable, he says, because first of all, it is stigmatization, which the country has been trying so hard to fight, and the world really, when it comes to HIV. These are just some of the examples that they come across. But also that call center that they have established, he says that they will go to hospitals and doctors' practices, not only in Johannesburg or Gauteng, but around the country, to find out what is really going on, to engage with the people in consultations, to find out how people are really receiving public health care in the country, and healthcare in general, really, in South Africa. Natasha.
All right, Nthakoana, thanks very much for that. We'll leave it there for now. Our Nthakoana Ngatane covering that march for us. Well, let's